So Baby and Me set up in October 2019 was when we started taking our referrals, and our team's made up of a senior social worker, a specialist health visitor, family support workers and a sessional midwife. So our overall aim was to reduce the amount of newborns coming into care, with recognition that there was practice and process that needed to change within local authorities to try and support those numbers reducing. So one of the things we started to do was to take referrals at a much earlier stage. So from around 12 weeks in the pregnancy rather than 20 weeks, which is what it had been historically. And what that allowed us to do was to have a much more longer period of time to work with these parents to give them the opportunity to evidence and sustain change in order for them to evidence to social workers and to courts that it was safe for them to take their children home. So our model is a relationship-based model, and I think that's the most important thing when it comes to how best to work with parents who've had children removed previously. So our priority is around trying to be that safe and stable figure for the parents so they can be the safe and stable figure for their child. So we try and create an environment which allows both the child and the adult to have a sense of belonging and thrive. So we use a trauma-informed approach, and we're quite flexible in what our model looks like, and we make necessary adaptations to fit the service around the family. So last year in our data, I think only about 3% of parents didn't engage with the service, which is a real credit to the workers in showing just how well they are able to connect with these families. And I think that comes with that trusted relationship and just building hope at a time where they're really sceptical about service intervention and they're really frightened about what the future holds for them.